one number could raise the cost of the state pension plan by millions, and officials could soon change it. Plus, in the wake of another vaping death in Kansas, one city is changing its tobacco codes. And the number of our children taking their own lives jumped by 50% again here in Kansas. That's what we're talking about right now on Kansas Week. I'm Pilar Pedraza, and this is Kansas Week. It's a trend that's on the rise across the country, and Kansas is no exception: youth suicide. The Attorney General's office released numbers this week showing a 50% increase in children taking their own lives again. KSN's Alexis Padilla takes a look at what Kansans are doing about the problem.
32. That is the number of suicides for Kansans 10 to 17 years old in 2017. The Attorney General's office released the report Wednesday, saying it is a 50% increase from 2016. President and founder of Stop Suicide ICT, Nicole Fenolio, says her group is working to combat that by partnering with local schools for prevention training.
So important that the people that these kids are around the majority of their day learn to kind of pick up on what those signs are that someone's struggling and know how they can help them.
The Mental Health Association says anyone can help someone in need. It can be as simple as asking a question.
Just checking in with, are you okay? What's going on? I'm here to talk. Definitely not ever saying, what's wrong with you?
Fenolio says people should not be afraid to mention the S word.
I think so many people kind of are afraid that if they mention the word suicide or if they ask someone if they're having thoughts, that's going to put the idea in their head. But research tells us that that is absolutely not true.
If you are having thoughts of hurting yourself, there is one main message Alan wants to pass along.
The biggest thing that I can say is that you're not alone.
And joining me on the desk this week to discuss this and more, we have Phil Journey, former state senator and district court judge here in Sedgwick County, State Representative Elizabeth Bishop, Democrat from Wichita, and Dr. Russell Arbin Fox, political scientist from Friends University. Thank you so much.
Thank you.
So starting with all of this, this is the second year in a row where we have seen incredible increases in the numbers of suicides, especially among youth, but suicide in general in the state, in Sedgwick County. Certainly in that story, we talked about things that individuals can do, but the question becomes, where's the state role in all of this? And has the state fallen down on the job? Phil?
I think there's more the state can do. For example, we have a child death fatality board that does a review of all of the cases in the state to try to find common threads and a pattern so that action can be taken. And I think it would be a wise thing in the legislature to recreate that regarding suicides for all Kansas citizens. Particularly in the young people out there, I think that it is a different set of circumstances, and I would be less than surprised if anxiety and depression as a result of social media exposure is not at a significant number of the increase. And it's really recognized in the psychiatric community. There are a number of symptoms one can look for in their offspring. And it sounds like, when you read it, that it is almost like an alcoholic in the things they're doing, like they're neglecting schoolwork, that they're taking their phone to bed with them, that the list just goes on and on of the danger signs that show an obsessive behavior regarding social media. So take the screens away and kick them outside, tell them to go play.
I don't want to be overly clinical about something that's obviously so sad, so tragic in the lives of so many people, but I would like more information. If you take a look at the information that we're getting from the Centers of Disease Control and other national bodies, the increase in suicide nationally is mostly a function of teenage boys. Is that in fact the same in the state of Kansas? What kind of breakdown do we have in the data? How much can we analyze, the possibilities of drug use, the opioid crisis and whatnot? And we also have to recognize that some of this is reporting. I'm 50 years old. My two other panelists have a few more years on me. All three of us, though, I'm sure, can think of circumstances, sad circumstances, where we knew of families or friends that maybe didn't want to talk about suicide. They didn't want to talk about what happened to their daughter. They didn't want to talk about what happened to their uncle. Some of this really is a matter of people just being more willing to report the facts. And we need to be able to tease out that as well. I mean, is reporting increasing? And how much is that increase affecting the overall increase of the numbers that we're seeing? Again, I don't want to downplay the seriousness of this, but I'd like to know more.
Spoken like a true academician.
I'd like to address it from a behavioral health standpoint. I recently took part in a portion of the mental health tour that a bunch of the money committee people from the legislature took all around the state, going to the hospitals, going to the clinics, going to the places where substance abuse is being treated, going to the children's psychiatric hospital that just opened up on 21st Street. And one of the things that we kept hearing is that there is a shortage of social workers and other licensed people that are able to provide behavioral health services. So I am looking at what the state might be able to do from the standpoint of perhaps forgiving loans. I am told that we are not a shortage of behavioral health workers area, but yet with some of the early research that I've done, it appears we may be. So I'm trying to get that firmed up, and then maybe that we could add a bit more in the budget next year, because there is a federal program and we could leverage federal money that would help to forgive loans and encourage people to get trained here, stay here, or recruit them to come from other places to help us, because this goes across the board. Not only is it suicide, but there are other behavioral issues that need to be addressed among the youth as well as the adults. It's also related to the crime rate locally.
Yeah, we've talked a lot about that on this show here as well. Well, I'll be interested to see what comes out of this tour and some of the ideas that you're sharing with us as the legislative session gets going again in January. Well, moving on Monday, Kansas reported the second vaping-related death in the state in 2 weeks. Hundreds of Americans now reported to have a vaping-related breathing illness. And Olathe schools are looking at suing Juul, the leading vaping manufacturer, over a marketing strategy they say is aimed at teens. One Kansas town, though, is taking a different tack, changing its tobacco sale laws. KSN's Jasmine Haynes shows us how.
Glad that Newton was very proactive in this.
Zachary Dillon, owner of August 8th Vape Shop in Newton, welcomes the city's new ordinance increasing the tobacco buying age to 21. It's a change his shop already made back in July.
I had personally felt that way for a while, that's a move that we should make.
But not all agree. We reached out to other smoke shops around town and some offered no comment. Some of the community think it's not fair.
It shouldn't have been passed, but now that it is, it's going to be pretty weird for some people.
All tobacco products are covered in the ordinance, including cigarettes, e-cigs, cigars, and chewing tobacco.
We are keenly aware that this is not going to keep someone from getting those products if they want them. It might hinder them here in Newton. We have to do what is right for Newton, what we believe is right for Newton.
The city says if someone between the age of 18 and 21 is caught in possession of a tobacco product in Newton, they will not be fined or penalized.
Now, I have spoken with some lawmakers who said that they really want to work on some laws tightening restrictions around vaping in Kansas. But one particular issue they're running into is lack of knowledge about the secondhand impact of vaping. So not on the vapor themselves, but on those around them. How does that play into passing medical laws?
The thing that surprised me about the news conference that Lee Norman, the head of Kansas Department of Health and Environment, had is that vaping products are not regulated. That was really news to me, and I know that this is an issue that's moving so fast it's kind of hard to keep up with it in terms of what the federal government is going to do and the Health and Human Services at the federal level. But the other thing is if people go to KDHE ks.gov, they can find a vape-free schools toolkit that will tell them how to go about making sure that their school has sufficient and effective policies regarding vaping.
Yeah. And I know as a teacher who was in a classroom just a couple of years ago, it's very difficult. I mean, kids ask to go to the bathroom, you can't tell them no, even though you know half of them are going to end up vaping.
I would be really curious to read, a good study, or even just a good personal account comparing how schools dealt with smoking in the 60s, 70s, and 80s versus how that strategy is emerging today. I mean, I thought it was very interesting that you mentioned, Olathe schools looking at bringing a lawsuit against Juul. My understanding is that Goddard School District has also indicated a willingness to explore that. Newton's actions here, I mean, it's going to be very easy to criticize them. People will talk about how, well, you've got the Wichita market right next door. You've got, all of these other municipalities with different rules. I wonder how much of this they see as laying down a line that they hope will bring other organizations like schools into taking the issue more seriously, at least as much as actually trying to do something about the specific problem within Newton. I mean, that could be part of their rationale.
Well, and from the interview that we just heard with the mayor there, it sounds like it was to a certain extent. She said, we've got to do what's right for our town. And certainly we have seen that play out in the history of Kansas, from Sunday blue laws as far as alcohol sales, to the push for hemp and marijuana growth. So it's not a new tactic in Kansas, for sure.
No, not at all.
It is hard to believe, but the Food and Drug Administration does not regulate vaping products, and that's because the law has not kept up with the science.
No.
I have read reports that sometimes they contain things like the antifreeze in your car, ethylene glycol, something as a solvent to get the flavor or the nicotine into the body. The crystallized form of nicotine used in the vaping product goes past the blood-brain barrier much more efficiently than inhaled tobacco products. And so it's much easier to get addicted. Juul has stopped advertising completely, which is the #1 manufacturer. It's important to remember this is a multi-billion-dollar industry that is entirely unregulated. The damage that is occurring in their lungs tends to be permanent scarring and actually cell destruction in their lungs, and that's why they're dying. And so recovery is marginal at best and only moderately effective. So essentially, they have to learn to use other parts of their lungs because part of it is actually destroyed by these products. There seems to be a link to illicit products containing the active ingredient from marijuana using unusual solvents like vitamin E. There's a real danger out there. Nobody knows what's in those little vials. And the health officials have said, just stop, just stop until we know what in the world's going on.
Phil, I hadn't heard what you said about Juul. They've ceased all advertisements?
Yes. Yeah, that was
their
announced yesterday or day before.
Stepped down, was fired, I don't remember. And
I heard about the firing, but I didn't.
It was all a series of things that happened there at the same time.
Okay.
Yeah.
Interesting.
Now, one thing I find interesting, though, is sometimes overlooked when we're talking about the vaping deaths is that everyone who's passed away so far, and I understand most of those who have had the serious illness,
most of them
already
have been older.
They're older, they've had an underlying health problem.
Yes.
It wasn't just the vaping. And
the ones that have survived will still be probably permanently scarred.
Oh, yeah.
And
no
a
doubt
lot of
about
those
it.
are young.
Yeah.
Very young. Yeah.
Well, in the Washington Post this week had a very interesting article on it. I actually brought a copy about how the crackdown on vaping could end up helping Juul and hurting small businesses, because small businesses, the vaping industry has been responsible for the majority of the growth in small business over the last decade.
Walmart has ceased selling the products too, and they've pledged to sell out of their current inventory and not replenish it. Of course, they didn't want to throw it in the trash, but
They're drawing it down.
Yeah. When you look at how pharmaceuticals are certified for FDA, the manufacturer pays for the testing and for the review and the certification. And I'm sure that will put many of the smaller or mom and pop manufacturers under immediately.
Well, of course, all of this costs money, and certainly at the state level, money has been an issue in this state for several years now.
That's a good tie-in.
Yep. So the question becomes, can the state of Kansas fix what some call a broken system? A lot of money would be needed to do it. An advocacy group is suing the state's Department of Children and Families, and that lawsuit is intensifying. Cake's Annette Lawless explains what's going on in that case.
It's really amazingly bad. I think the night-to-night placements haven't changed. The kids who are not going to school, who are being housed in offices during the day, that's still continuing.
Problems continue to persist for kids in foster care. That's what a recent amendment to a lawsuit claims, saying nearly 7,500 kids in the system continue to be victims to extreme housing disruption. 2 girls and 2 boys added to the suit. One 17-year-old has been moved to more than 100 placements in her 3 years in state custody. She was also forced to have sex in her group home. A 12-year-old moved to at least 16 placements since this March alone. The boy diagnosed with several disorders, but they say he is not getting proper care.
These kids have so much instability in their lives, and they're not going to school, they're not getting mental health treatment that they need. It's very sad.
Teresa, Woody, and Larry Root are lawyers with advocacy group Kansas Appleseed. They fear the constant moving and lack of care will only fuel the challenges to these children. Some taken from a shaky home life and placed into what many describe as a worse living environment. This leads to runaways. Advocates say 1 in 7 runaways ends in the hands of a sex trafficker. Though DCF has agents to help track these missing kids, the suit claims the risk of children becoming victims of sex trafficking is prevalent among vulnerable foster youth. I reached out to DCF for comment about this case, and while they cannot say anything about pending litigation, they did offer me this email, a statement saying, quote, "The agency is committed to improving outcomes, including strengthening families, reducing the length of stay in foster care, and implementing evidence-based practices to engage families in placement stability." Do you think with the change of leadership within the state, from going from Governor Collier to Governor Laura Kelly, is that a possible ray of hope?
Well, the proof will be in the pudding.
We're hopeful that the change in administration will make a difference.
We as Kansans have a moral obligation to these children. There are 7,500 kids, give or take, out there that really are our kids, and we have a moral responsibility to make sure they're properly taken care of.
Now, I've spoken with a lot of folks on both the legislative side and public citizens who said they had hoped and expected to see rapid change with a change in administration. That doesn't seem to have happened. Perhaps that was a little bit of pie in the sky. But the question becomes, have we reached the point where it's time to say enough is enough, let's rebuild the system from scratch? Is the system too broken to be fixed?
What's the dividing line between rebuilding it from scratch and trying to fix it from within? I don't know. There's so many different moving parts. There's obviously many procedures that need desperate reform. Obviously, DCF was underfunded systematically for a long time. There were problems with oversight. There was, corruption within the ranks of DCF. I'm not sure how we want to separate out any one part of that and talk about how we're going to rebuild the whole thing, as opposed to, engage in the slow, hard work of putting it all, back on the lines that we had originally wanted it to run on. I mean, you talked about people who were looking for, rapid changes. I really doubt anyone in the Kelly administration ever actually promised anything like that. I mean, they came in and they took a look at it, and they knew that after years of problems, there was years of work waiting in front of them.
Yeah.
I know that there have been a lot of positive changes in DCF. For one thing, they have hired more people and the caseloads have reduced. and that is playing out in a better quality of the care that they're providing. But in the meantime, we still haven't replaced any of the supports that we've managed to knock out from under families in the HOPE Act itself reduced a great deal of support that families had, and that is the passage of the HOPE Act is when this burgeoning increase in the number of children going into the system began to climb, and it's now double what it was prior to 2015.
You've heard me talk about how important money is in the legislative session and how lots of decisions are based on that quantitative analysis. The problem is too that with DCF's budget, I think it's still the fastest growing portion of the budget. It grows faster than education. You know, it is something that needs more support, obviously, but there are competing interests, education, corrections, all of these other portions. And, you know, there's only one place the money comes from yours and my pocket. So, you know, we will see what this court case does. I'm hesitant to comment on that, given my current role in public office. And, you know, we'll see what that order is. Yeah. So, you know, the next legislative session will certainly be something Elizabeth will get to experience, and I'll be up there periodically.
It'll be interesting in the old Chinese proverb sense of the word interesting.
Yes, it's a curse. I know.
Well, talking about competing interests financially, the Wichita Eagle this week reported that a single number with the power to saddle Kansans with millions of dollars in future payments to the state's public pension system could be about to change. According to the Wichita Eagle, KPERS, the state's public pension fund, will soon decide whether to downgrade its estimate of how much it expects investments to earn. That would force state lawmakers to put more money into the pension, millions of dollars more every year, to make up for the shortfall. Not downgrading those expectations, though, could mean higher costs for KPERS for several decades if investments underperform. KPERS just cut its rate in 2016 from 8% to 7.75%, costing the state about $500 million more dollars. It was the first cut in decades. Another cut now, the Eagle reports, would probably have a similar effect. At the same time, KPERS has been performing well. Over the last 10 years, the rate of return on investments has been nearly 10%. And as you were just talking about, Phil, difficult decisions to be made. And I know this is something you currently deal with in the legislature, Elizabeth, just trying to figure out how much money goes where.
Well, I was asking Mr. Journey or the judge,
just Phil,
if he knew when the
jumpsuit.
consensus revenue estimating group is, and we don't know, but it's coming up.
Yes.
And that will give us the baseline for should give us the baseline for the upcoming legislative session, and we'll have an idea of how many cookies are in the cookie jar. This is very difficult to do.
Okay, quick numbers. KPERS pays out $1.7 billion a year in benefits to tens of thousands of retirees from Kansas government. That money is basically from revenue that a great big old pot of money earns. You know, they have investments all across the Dow and whatever. If they reduce their return estimate by 1/4%, that is tens of millions of dollars that the state will have to fund from the general fund budget, which will suck from education, from DCF, from Department of Corrections, from everything else. And you know, this is a number that the Revenue Estimating Group uses to help create what they have to spend in the budget, and it's really scary.
Conversely, if they don't, it increases the risk to the system. And Kansas now is not at its 7.25, I think, and it's not the highest. And of the 4 states around, it's kind of in the middle, maybe just a touch on the high end, but it's not the highest, and it may possibly need to be reduced. It's tea leaves. You know, they're going to have to figure it out.
We'll let them read the tea leaves. And we're going to talk about something else that created something of an uproar this week. Counties across Kansas complained to the Secretary of State's office about cyber attacks on their websites last month, catching at least one county during an election. The Wichita Eagle reports the cyber attacks crippled the websites of about a dozen Kansas counties, replacing their homepages with cryptic messages and an image of Mecca. The hacks defaced the websites, but they did not affect other systems, and the Eagle says it doesn't look like the hackers took any data hostage. The Eagle learned through an open records request the counties contacted the Secretary of State's office, sometimes within minutes of each other, on August 3rd through August 6th, primary day. At least one of the emails on Election Day stated that there was something trying to infect the system during the attack. One county decided not to post its election results online because of the attacks, instead notifying local media directly. The county's IT director told the Eagle the incident did not in any way interfere with the terms of conducting the election. And the Secretary of State's office said that only 2 of the 14 counties hit on Election Day were actually holding primaries. All of the websites under attack were hosted by Thomson Reuters. At least one county is now changing its web provider. And Elizabeth, you have the breaking news for us on the desk here. You discovered as we were preparing for this show that there is a group out there that's been checking election machines, and it's
white hat
good
hackers.
news for the election machines.
It was bad. They were able to break into they went out and they bought a wide array of election machines and proceeded to hack into them with not much trouble and into each and every one of them. I also was watching a C-SPAN committee meeting today, and one of the things they said is if you're going to use a thumb drive or an element to go out and set up your election machines and then reset them and so forth, you have to make sure that it was manufactured in the United States and not somewhere out of the country, for fear that there is malware in there that gets fed into the system.
Wow.
I'm going to get you some water.
Some pretty scary things when we're talking about an upcoming election that's going to be a major election no matter how you look at it.
I have taught cybersecurity to attorneys and judges, and this attack was very amateurish. Other more serious attacks, such as ransomware attacks, have occurred. Major cities like Atlanta suffered hundreds of millions of dollars in damage. Their ability to take anything other than cash payments for water bills was down for over 2 months.
Wow.
And
right. Well,
online payments were in, and the danger is real. Go out and learn how to keep your system safe.
And we're going to let that be the last word for today. Phil, Elizabeth, Russell, thank you so much for joining me. I've enjoyed our discussion. I hope you have as well. We hope to see you again next week. For now, have a great week.